In Module 3, we discussed the effects of neglect. Neglect is the failure to provide age-appropriate necessary care to the child. The four categories of neglect are physical neglect, emotional neglect, medical neglect, and educational neglect. Childhood neglect can have devastating consequences to the child's overall development in the areas of cognitive, social-emotional, language, and motor development. Children who have experienced neglect usually have developmental delays. Living in an environment that is neglectful or chaotic can decrease a child's IQ and cognitive potential. Lack of positive interactions through language can delay their language development. Lack of opportunity to explore the environment and to be exposed to normal experiences can affect both language and motor development. And neglectful or harsh treatment can delay or harm social-emotional development. Severe neglect in an infant can cause failure to thrive and attachment disorders. Chronic poor hygiene, improper clothing, and/or lack of medical care are all signs of neglect. A child who is living in poverty is 7 times more likely to experience abuse and neglect than a child not living in poverty. The more mobile and unstable the family, the higher the risk of both abuse, neglect, and learning deficits. Children who have experienced significant stress during childhood, such as happens during abuse or neglect, have brains that are less flexible in their thinking. They are in hyperarousal mode most of the time. This makes it more difficult for them to concentrate at school, to screen out environmental stimuli, and to learn new concepts. Global neglect and early lack of stimulation result in fewer neural pathways being formed in the brain, which results in lower IQ and less flexible thinking. Children who have experienced early abuse or neglect usually need intensive interventions and positive interactions in order to overcome their developmental deficits. Knowing the history of a particular student's early experiences often is the key to finding the strategies to help the student succeed.